Are you struggling with chronic lower back pain to the point where you're having trouble just standing up straight, or that you find that you can't walk for an extended period of time due to the fact that your back might feel like it's getting tight or tired or fatigued just after a couple of minutes of activity? Or do you sometimes feel a sharp or even a burning pain or sensation that starts right at the center of your lower back and then radiates out towards the sides of your hips, and that the only thing that you can do to relieve the pain is to sit down or to lie down and rest? Or do you feel like you've tried everything under the sun to try to get better, which might include trying chiropractic adjustments, stretches and exercises, massage, or even trying painkillers or anti-inflammatories, but that the only thing that seems to happen is that you might get some sort of temporary relief only for your pain to come right back, and if anything, it feels like your pain is just getting worse over time? Well, if so, and if you are someone who is looking for a natural solution to this problem that does not involve you having to take pills or to risk having surgery, then it's important for you to realize that the reason why you're not getting better isn't because of a lack of effort or that you aren't trying to get better, but instead it's most likely because you are making the very same and very honest mistake that so many people make, which is to be stuck in a trap of only treating the symptoms of your back pain and not focusing on fixing the real underlying root causes of your pain. So first off, my name is Dr. Kevin Mao. I am a physical therapist, and together with my wife Thuy Lu, we own and operate Balance and Body Restoration Physical Therapy Massage, which is a clinic located right here in Dublin, California. And every single day, we work with people who struggle with this type of lower back pain. And most importantly, we've been able to have tremendous success in helping our patients heal without having to rely upon pills, injections, or surgery. And our main goal with this video series is to share with you the exact strategies that have worked for our patients over the years, strategies that focus on identifying and treating the root causes of your pain instead of you potentially staying stuck only treating your symptoms. So first off, what exactly do I mean by treating the root causes instead of the symptoms? So the simplest way that I can try to explain this concept of a root cause versus a symptom is that the root cause refers to what is the true source of your pain that is causing your lower back to hurt, and that in most cases, the source of the pain might not be coming from your lower back itself. So just to use an example to explain what I mean, I want to talk about a patient that we've been working with somewhat recently. She had just turned 61. She had always had a little bit of back pain through the years, but since she's pretty tough and has quite a bit of a high pain tolerance, and for years she just always kind of just pushed through the pain. But over the past couple of months, her back pain, it just started to get way worse. It got to a point where she was having trouble just getting out of bed in the morning. She couldn't even stand up straight for longer than a couple of minutes, and she could barely even walk for more than a block or two because her back would just kind of tighten up. It would get so tight, she'd have these burning sensations, and the only thing that she could do was just to sit down and lie down at home. And it even got to the point where she couldn't even cook dinner for her family. She said she'd be in tears by the end of cooking for her family, and that was something that she missed doing, and she always loved cooking. And the reason why she wasn't getting better was certainly not because of a lack of effort or that she wasn't trying to get better. She tried chiropractic, she did physical therapy, she tried massage, and pretty much did everything that she was told to do. But just after a couple of months, nothing had really changed, and if anything, her condition was just getting worse. It was at this point she had to go see a spine specialist where she was diagnosed with, degenerative disc disease and arthritis, and she was told that since her pain was getting better, that her pain was probably just due to old age, and that there wasn't anything that she could do, and that she just either needed to learn to live with her pain and accept her condition, or that she could try pain-killing injections, or that she was told she might even need back surgery, but that it wasn't even a guarantee that it would even work. This really frightened her, having seen her mother and knowing friends that went through back surgery and just seeing what a nightmare it was. She swore that she would never undergo surgery unless it was the absolute last resort. But long story short, in working with us, upon further examination, what we found was that her lower back, at least structurally, wasn't as bad as it seemed. She still had decent mobility. Her x-rays and MRIs actually looked no different than most people around her age. But what we did find was that it was her back muscles that felt very sore and very tight and very tender, And upon digging a little bit deeper, we found that the reason why her back muscles felt so tight was because of the fact that they were overworking to overcompensate for problems that she was having in her hips and her knees. Because what we found out was that about 2 years before her back problems started, it was her hips and her knees that were actually giving her the most issues. Years of working as a secretary at a medical office combined with a couple of old knee injuries caused the muscles of her leg to become very stiff and very weak over the years. But what our patient didn't realize was happening was that every time she would try to stand or every time that she would walk, the reason why her lower back was hurting was because the muscles were actually overstraining themselves to try to compensate for the lack of weakness or lack of strength that she had in her hips and her knees. And this is what we determined was the actual source of her pain. And if anything, one of the reasons why her back pain was getting worse is because most treatments that she was doing on her lower back was actually creating even more stress on her lower back, despite the fact that her back was already under too much stress to begin with. This was similar to a situation if you are working on a project with 3 other people, and if your other teammates are slacking off, then you're going to be the one that is overworked and overstressed. And when you only spend time treating the painful area, that is like putting even more work on the part of the body that is already overworked to begin with. And instead, what we need to do in this situation is to identify which parts of the body are not doing their job correctly, and then restore the proper function of these outer surrounding parts of the body, which will then help take stress and pressure off of the lower back. And from there, as you gradually remove all of that pressure and stress off your lower back, it will finally have a chance to breathe. It'll have some space to heal. And this is how we're actually able to get our patient better. And we know this because what we ended up doing for our patient was to first stop all of the treatments that she was doing on her lower back and instead focusing only on fixing the underlying problem that she had in her hips and her knees. And with this strategy, within just a couple of weeks, her pain had already reduced dramatically. She was already able to stand for way longer and walk for longer stretches of time. And most importantly, that constant feeling of tightness and fatigue in the lower back wasn't coming back as well. And then within a couple of months of just continuing to build on the strength and the mobility in her hips and her legs, she was all the way back to doing long walks around the neighborhood without her back, again, feeling tight or tired just after a couple of minutes. She was standing for taller for way longer, again, without that constant tightness or tension in her back. And most importantly, she felt like she was able to get back to being active and engaged within the lives of her friends, her family, and her loved ones. And this included being able to get up and off the ground to play with their kids and their grandkids on the weekends, going on short trips and vacations with her husband, and being able to actually enjoy her time because she wasn't worried about her back going out at a moment's notice. And lastly, she's now back to being able to cook dinner for her family without pain for the first time in almost 2 years. And all of this happened despite the fact that just a couple of months ago, she was practically convinced that she was going to end up either permanently disabled or end up on an operating table getting back surgery. And this is just one example of this phenomenon where the pain was that the person was feeling was in the lower back, but the actual root cause of the pain was actually coming from somewhere else. And the reason why it is so important to understand this concept is because, similar to the patient that I just described, I know that there are so many people out there who've been struggling with chronic back pain for years and have tried everything to get better. And when the pain just doesn't seem like it's going away, it can be very easy to think that this is just how it is. This is just a part of aging. You just need to learn how to accept it. And the person just ends up throwing in the towel and just doesn't even try to get better. Or even worse, they end up going down a path of relying upon pain pills or injections just to mask the pain. Or in some cases, they end up having surgery, but the procedure doesn't work, and it actually makes the situation worse. And while I understand that in some situations, surgery is necessary, and I'm not trying to say that everybody with chronic back pain is going to get back to doing backflips or running marathons in a couple of months, but what I am trying to say is that we have just seen with our own 2 eyes that it is absolutely possible for most people who are at least health conscious and active and motivated to be able to heal from chronic lower back pain. But in order to do so effectively, you need to learn how to see the body as a whole and understand how everything in the body is truly interconnected. And then from there to learn how to focus on fixing what needs fixing instead of staying stuck only doing things that might only feel temporarily good at the time. And this is the main reason why we created this video series, which is to share with you some of the most important lessons that we have learned in working with our patients over the past 14 years, so that you too can learn how to identify and also fix the real underlying root causes of your back pain. So what is this program going to be about? So again, in over the years in working with hundreds of people who struggle with this exact type of chronic lower back pain, we have identified 5 very common but little known underlying root causes of this condition. And while these are by far not the only 5 underlying root causes of chronic back pain, these are at least the most common problems that we see with our patients on a daily basis. And these are, again, here are people who struggle with back pain for years, and that we've been able to get our patients better by following these strategies that I want to share with you in this program. So what you're going to find below are 5 different video modules that we have created that will describe to you in detail what the 5 most common underlying root causes of chronic lower back pain actually are, that most doctors and chiropractors or even physical therapists don't even know exist. And then from there, we'll share with you a breakdown of the anatomy and the physiology of these problems so that you can understand how these underlying issues cause your lower back to hurt. And then from there, we'll share with you some very simple self-assessments that you can perform on your own so that you can check to see which of these problems you may actually have. And then lastly, we'll share with you some of the best ways to address some of these issues through corrective exercise strategies that we have developed for our patients over the years, so that you too can get back to living the life that you want, free of lower back pain as well. Now, as a disclaimer, and the last thing that I want to say is that chronic back pain is very complex. And again, these are not the only underlying causes of chronic back pain. And while this mini series is designed to help educate you from lessons that we've learned in working with our patients, this is not a substitute for medical advice. So if you are going to try some of these exercises, you must check with your medical provider to make sure that you are in fact cleared to be able to exercise safely. And if you're someone who is experiencing sharp pain or has extreme pain, or if you just aren't sure if this is the right program for you, then I would advise that you not try to perform these exercises. Instead, consider reaching out to someone who might actually be able to accurately diagnose your condition to make sure that you're put in the right position to be able to heal and recover based upon around your situation.